I am doing my presentation on urinary tract infections, more specifically E. coli versus S. saprophyticus. So a little background information, UTI infections actually occur when bacteria invade a certain portion of the urinary system. So there could be upper UTIs, which occur in the kidneys or the ureter, and then lower UTIs, which can occur in the urethra or the bladder. So there's different kinds of severities for UTI. Now there's a complicated UTI, which usually involves people who contract UTI from hospitalization, so procedures such as catheterization, people with underlying diseases such as like diabetes or even pregnant women. Uncomplicated UTIs are when the host is normal, so the system usually occur in the lower urinary tract. The person usually has no prior diseases or instrumentation. I'm pretty sure their history of antibiotics can actually affect UTIs as well. So a little continuation, symptoms of UTIs include cloudy or dark urine, as well as blood in your pee, pelvic pain, sensation when peeing, as well as an odor, and then the increased urgency to pee. So upper UTIs can actually have more severe symptoms, and this includes maybe nausea, headaches, and things of that sort. And they could even lead to sepsis, which can be life-threatening. Now, UTIs are commonly caused by E. coli, but they can also be caused by different types of bacteria in this. So the epidemiology. UTIs are actually one of the most common infections, if not the most common infection contracted in the United States. Women are actually more prone to infections due to their shorter urethra compared to males. Males, I think, only make up about 20% of UTIs, so very low. Around 50 to 60% of women will contract a UTI at a certain point in their life, with most of these occurrences happening between the age of 19 and 39, when women are more sexually active. So recurrent UTIs are also common among young women, about 27% having a reoccurrence within the 6 months of their first diagnosis. Now, pyelonephritis is better known as a kidney infection, is less common, but it has about 250,000 cases per year in the US, but at least their recurrencies are lower. Health care associated UTIs, so basically UTIs caused by catheters, are less frequent than other types, making about 12.9% of cases. So a little more of the epidemiology continued. This chart pretty much just shows the different bacteria that can cause UTIs. More specifically, what I'm going to be focusing on is UPEC, which stands for uropathologic E. coli. As you can see, this is very, very present in causing urinary tract infections compared to all of the other numbers, as well as Saprophyticus. You can see the numbers are a lot lower than the other. Okay, so identifying and isolating E. coli. Now, E. coli is a gram-negative microorganism. So after E. coli attacks the urinary system, superficial facet cells, basically epithelial cells of the urinary system, are exfoliated, which frees IBCs into the urine and rids the host of thousands of bacteria. Now, these IBCs are often seen in urine tests of infected women and children. So to identify the presence of E. coli, you can conduct a urinalysis. Now, this is done by taking the patient's urine and using a dipstick, which will test positive for leukocyte esterase or nitrites. So E. coli can be isolated using the Marconi agar plate and looping it at 37 degrees Celsius for 24 hours, performing the catalase test. Now, identifying and isolating S. saprophyticus. Now, S. saprophyticus is a gram-positive microorganism contrary to E. coli. Now, patients with UTIs caused by this bacteria show a microscopic characteristic through chemical screening, but this isn't always successful due to low quantities of colony forming units. Now, it can be identified, however, through novobiocin resistance, lack of hemolysin and coagulase, and it'll have an intense pigment production, with about 65% of the stains being yellow and 35% being white, roughly. Now, this can be identified using a catalase test. So for treatment now, treatment for UTIs is commonly over the course of 3 days. Now, this can include medicine like ciprofloxacin, 100 milligrams, ofloxacin, 200 milligrams, about twice daily, and trimethoprim, sulfamethoxazole. Goodness. And that's also taken twice daily. Now, fluoroquinolones are also commonly used to treat UTIs, more specifically caused by E. coli. Now, E. coli has actually shown a resistance rate of 38% to ampicillin, 17% to TMP-SMX, and 0.8% to nitrofurantoin, and about 1.9 to 2.5% of fluoroquinolones. So, S. saprophyticus is susceptible to these antibiotics as well, that are usually prescribed for UTIs. However, this excludes nalidixic acid due to its resistance, but this also is taken over the course of 3 days, and single doses of quinolones are also effective. So looking into the future, being that bacteria are constantly growing resistance, as we just talked about, E. coli, both E. coli and S. saprophyticus have shown resistance to medicines, and that's only going to continue. So more research can be conducted regarding what drugs would be that these bacteria would be more susceptible to, and further research could also be conducted regarding prevention for UTI, such as a vaccine, considering they're one of the most common infections contracted. But here are my references, and that concludes my presentation.